ਹੈਲੋ ਜੀ, ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਸਾਰਿਆਂ ਨੂੰ। ਵੈਲਕਮ ਟੂ ਗਲੋਬਲ ਨਰਸਿਸ ਇਨਸਾਈਡ। ਅਗਰ ਤੁਸੀਂ ਨੇ ਆਪਣਾ ਐਨਕਲੈਕਸ ਕਲੀਅਰ ਕਰ ਲਿਆ ਜਾਂ ਆਰਨ ਦਾ ਜਾਂ RPN ਦਾ ਲਾਇਸੈਂਸ ਤੁਹਾਨੂੰ ਮਿਲ ਗਿਆ ਹੈ, ਕੰਗ੍ਰੈਚੁਲੇਸ਼ਨਸ। ਤਿਆਰੀ ਕਰਨੀ ਹੈ ਜੀ ਆਪਾਂ ਨੇ ਕਲੀਨਿਕਲਸ ਦੇ ਵਿੱਚ ਜਾਣ ਦੀ। ਤਾਂ ਮੈਂ ਤੁਹਾਡੇ ਲਈ ਕੁਝ ਰਿਪੋਰਟ ਸ਼ੀਟਸ ਲੈ ਕੇ ਆਈ ਹੈਗੀ, ਬਿਲਕੁਲ ਕਾਸਟ ਫ੍ਰੀ ਨੇ। ਆਈ ਨੋ eBay ਦੇ ਉੱਤੇ ਲੋਕ $2-3 ਦੇ ਵਿੱਚ ਸੇਲ ਕਰਦੇ ਨੇਗੇ। ਤੁਸੀਂ ਮੇਰੀ ਵੈਬਸਾਈਟ ਦਾ ਲਿੰਕ ਮੈਂ YouTube ਚੈਨਲ ਦੇ ਉੱਤੇ ਪਾ ਦੂੰਗੀ, ਵੀਡੀਓ ਦੇ ਨੀਚੇ ਵੀ ਲਿੰਕ ਪਾ ਦੂੰਗੀ। ਸੋ ਵੈਬਸਾਈਟ 'ਤੇ ਜਾ ਕੇ ਤੁਸੀਂ ਫ੍ਰੀ ਆਫ ਕਾਸਟ ਇਹਨੂੰ ਡਾਊਨਲੋਡ ਕਰ ਸਕਦੇ ਹੋ। ਡੋਂਟ ਵਰੀ, ਤੁਹਾਨੂੰ ਕੋਈ ਈਮੇਲ ਸਾਈਨ ਅਪ ਕਰਨ ਦੀ ਲੋੜ ਨਹੀਂ ਪੈਣੀ, ਤੁਹਾਨੂੰ ਕੋਈ ਸਪੈਮ ਈਮੇਲਸ ਨਹੀਂ ਆਉਣਗੀਆਂ ਮੇਰੇ ਵੱਲੋਂ। ਸੋ ਇਸ ਸ਼ੀਟ ਡਾਊਨਲੋਡ ਕਰ ਲਓ। ਮੈਂ ਸਭ ਤੋਂ ਪਹਿਲਾਂ 1 ਪੇਸ਼ੈਂਟ ਪਰ ਸ਼ੀਟ ਰਿਪੋਰਟ ਕਿੱਦਾਂ ਲੈਣੀ ਹੈਗੀ ਉਹ ਡੈਮੋਸਟ੍ਰੇਟ ਕਰੂੰਗੀ।
Okay, so let's get started on this. Start by writing down your patient's name. Let's say it's Mr. ABC, and your patient's age, code status, whether it's full code or DNR, DNI, your patient's gender, your patient's location. We're gonna say our patient is in room 2, bed 1. And why your patient came to the hospital, what was the diagnosis, was any surgical procedure done. Let's say your patient had lap appendicitis, and how many days your patient has been in the hospital. Let's say it's post-operative 1. And then, of course, your doctor's name. Let's say Mr. XYZ. And then we're going to chart down if your patient had any medical history. Let's say diabetes mellitus, patient had hypertension. And then under isolation precaution, if your patient is positive for any communicable disease, you're going to chart the precautions that needed to be taken, so rest of the medical team or the family friends can be made aware that they need to wear PPE. And under mobility, you're going to chart how your patient is moving. Is your patient independent or they need assistance? If your patient is using any assistive devices, let's say your patient is using cane or two-wheel walker, or your patient is wheelchair bound. And then going to say how your patient is transferring. Do they need a Hoyer lift, or they just pivot to the commode, or they walk? And then how your patient is moving in the bed. Under alerts, you're going to chart information like if your patient is high risk for falls, does your patient need a bed alarm or a chair alarm? Is there a high risk for elopement? Is there any threat alert that you needed to be aware of? And under allergies, you're going to chart if there's any medical allergies or any environmental or any food allergies. What kind of reactions that patient had, and when was the actual allergy that happened. You can discuss all this information with your patient. And under diet, you're going to say if your patient is eating or not eating. If your patient is eating, what kind of diet they're on. Are they on any modified diets? Let's say patient is on minced or soft dental diet. What kind of fluids your patient is taking. Is it regular fluids or thickened fluids? How your patient is taking their medication, whether it's crushed in applesauce, taking whole pills with applesauce, 1 pill at a time, with water, all that stuff you can mention here. And then we're going to move to the IV fluids. So under here, you can chart if your patient is running any IV fluids. We're going to say our patient is running normal saline at 75, and our patient is having some IV antibiotics and have some replacements for NG tube. And under PRN medications, you can chart if your patient is needing anything for pain, anything for nausea. Let's say your patient is taking Gravol. And under tubes, you can chart your patient is having like NG tube, a Foley catheter. And under the drains, you can say, let's say your patient is having a JP drain. And under lines, you can mention like your patient is having a PIC line or any CVA lines present there. And for like NG tubes, you can chart if your patient, what number it's sitting at. So if it moves, you or the person coming for next shift is aware. And under vital signs, there are a little place where you can see how frequently you have to do patient's vitals. Is your patient on room air or do they need oxygen? Is there any need for OSA monitor? And there's a timeline stamp where you can chart when you need to come back and do your vital signs. And under equipment section, you can chart if your patient is using any hospital or brought any equipments from home. Let's say your patient brought their CPAP machine from home to the hospital. Any IV pumps they are using. Is there a PCA or epidural pump they are using for the pain management? Are they on oxygen? Moving to the lab section, you can chart your lab values here. When I chart my labs, let's say if sodium's value is normal, then I'm not going to chart it on my sheet. But if it's off the normal limits, then I will definitely chart it so I can remember to check it with the patient's physician. And then you're going to chart your systemic assessment. It's like your genitourinary, your GI, neuromuscular, respiratory, cardiac. For example, under genitourinary, you can say if your patient is voiding, not voiding, whether they have a Foley catheter, is your patient continent or incontinent. Under GI, you can say stuff like when was the last bowel movement, whether your patient is passing any gas, how does patient's abdomen looks. Is it distended? Is it rigid? Is it soft to touch? Is it flat? Any hernia present? Under neuro, you can say if there is any weakness in any arm, any sensory changes. Muscular, you can assess patient's pulse. Is there any pain with the movement? Irregular respiratory and cardiac assessment. And under skin and wound, let's say your patient is post-surgical, you're going to keep an eye on the dressing, whether there's any drainage present or not. And you can also chart if your patient is having any bed sores. Is it getting better? Is it unchanged? Is it deteriorating? Stuff like that. And under peri pads, if your patient is gynae, you can mention the number of pads. Under follow-ups, let's say your patient is having swallowing difficulty and speech language pathologist is coming in to assess your patient. Patient is being followed by internal medicine or nephro team. And under test and procedure, let's say your patient is scheduled for an ultrasound. And under updates and orders, if I'm receiving any new updates and orders, I'm gonna write it down under there so I can pass it on to incoming staff as well. Let's say I got an order to discontinue patient's GP drain, or I got an order to trial a void for patient if patient had a Foley, or I got an order to try clamp patient's NG if patient is tolerating it or not. Under the plan, let's say your patient is going home, but they need home services. So we're going to make sure all the forms are filled before sending patient home. Or if physiotherapy have to come and reassess patient tomorrow. Stuff like that. Anything that needed to be planned before sending patient home. And then at the bottom, we have this little section. I call it as a timeline. It's divided into small time stamps. You can change the timestamps as per your own convenience. Let's say you go start your shift at 7, you do your AM care, you do your AM assessments, you mobilize your patient, getting patient up from the bed, going for a walk, you did your medications, you're charting your intake output if it needed to be done hourly. In the next timestamp, let's say you are doing your dressing changes, your JP drain, your patient have SLP assessment scheduled, or you're doing your medication, again you're doing your vitals and pain assessment in that timestamp, and then later your patient is going down for an ultrasound, for vitals, for pain. You're again a reminder to chart your intake and output, and then in the last end of your shift you're doing your NG outputs, you're doing your NG replacements, you're emptying the Foley. It kind of help you to stay on the track. And this sheet is helping you to give you a walkthrough when it comes to giving or receiving the report, so you don't forget important stuff. If you think it was useful, please give it a thumbs up, subscribe to my channel, and do share it with your friends. If you think it needed to be changed, something needed to be changed, please leave a comment. Thank you. I wish you good luck for your first shift. I hope all the resources I'm providing are helpful. Thank you so much.